Thank you for attending today's AAPI Heritage Month webinar. My name is Bei Wu. I'm the Dean's Professor in Global Health and the Vice Dean for Research at NYU Raleigh-Myers College of Nursing. I'm a principal investigator at the Rutgers-NYU Center for Asian Health Promotion and Equity. Today's seminar is sponsored by this center, and it focuses on the impact of climate change on health among Asian populations and the interrelationship between climate change and the healthcare system. As we know, climate change is one of the most pressing global challenges of the 21st century. Climate change has significant implications for human societies, including health and healthcare system, as well as the environment. Individuals, community, business, and the government all play crucial roles in addressing climate change. Today's webinar highlights some of the ongoing efforts of policymakers and our researchers on this topic. Next, I would like to introduce Dr. Soko Setoguchi as the moderator of today's event. Dr. Setoguchi was recently appointed as a principal investigator from Rutgers for this center. Dr. Setoguchi, the floor is yours.
Thank you very much, Dr. Bei. So thank you everyone for joining. As introduced by Dr. Bei, we're going to talk about climate change and also intersection between climate change and healthcare, and really specific issues and impacts on Asian Americans in this country. During this hour, we will have a video recorded by Mr. Andy Kim, and we'll start with that. And then we'll move on to a panel discussion. We have 7 distinguished panel members, 3 from the community and 4 from academic institutions. Let's start with the video. Stephanie, please.
Hi, everyone. I'm Congressman Andy Kim, and I want to say thank you for inviting me to say a few words. I'm sorry I'm not able to join the panel discussion this time around, but I'm glad that you're doing it. I'm glad that we're finding ways to be able to jump in and try to understand the effects on our broader community. First, I want to start by saying happy AAPI Heritage Month. It's always an incredible month of dialogue and communications, celebratory, but also lifting up obstacles that the community is facing. And that's exactly what you're doing. You're showing the importance of the API community in this country, but also looking out and doing the research into how do we make sure that that community is successful, has the stability and security that it needs. And certainly when it comes to climate change and healthcare and the intersection between the two, we see a lot of vulnerabilities. I saw a lot of this initially when I worked as a member of the Select Committee on the Coronavirus Crisis. I was the only AAPI member on that committee across our government and Congress. And we saw how the health disparities facing the API community were very pronounced during the pandemic, how the response and support to the API community was not at the level that it needed to be. And that was something where we needed to try to course correct and redeploy resources and efforts to be able to fix that disparity. Now, what we're trying to think through are the challenges facing with climate change and healthcare as well, which has got similarities to what we just talked about, also differences there. Things that we're doing when it comes to infrastructure, when it comes to investments with our own community, things to make our communities more resilient to climate change, and to understand what the healthcare consequences would be if we didn't take the actions needed. That is absolutely necessary for us to be able to think through the viability and the strength of the API communities across this country. I know in New Jersey, we have a lot of those conversations where we see how these communities, especially communities where API families are living, that they are, some of them are living in vulnerable areas, places that would have problems should we see some of the worst impacts of climate change rear its head in the coming years or afterwards. So I just want to say thank you for lifting up these issues, doing this research, to have Rutgers and NYU and other institutions engaged on this and looking at it in this with this type of precision, it's important. And I want you to know I'm paying attention that a lot of us are looking towards that research and that information, that data to help us make decisions. And I'm glad that you're thinking about this, not just within yourselves, but trying to figure out how we can get that out there to the broader public. So keep up the good work, and I appreciate you diving into this in Heritage Month, but we know that we need to work on these issues all year round. Thank you. I wish you all the best.
Thank you, Stephanie. So moving on to the panel part of the webinar, I'd like to introduce first Dr. Keith Jen, who is Associate Professor at the Silverman School of Social Work at Hunter College, City of University of New York. He serves as a co-investigator of the Center of Age and Health Promotion and Equity, our center, Community Engagement Core. As a social worker, scholar, and educator, his research focuses on the social determinants of physical and mental health for vulnerable populations, in particular for Asian Americans, immigrants, and older adults. Since 2020, he has actually provided his research expertise as a congressional fellow through the Health and Aging Policy Fellows Program to the U.S. House of Representatives Committee on Ways and Means Subcommittee on Health, Democratic Staff on issues related to mental health, disability, and population health data.
Thank you so much, Soko. It's such an honor to be here to talk to everyone. And also wanted to take this opportunity to introduce three of our community panelists. The first is Isabel Cheng, LMSW. She's the Executive Director of Hamilton Madison House, which is a nonprofit settlement house established in 1898 to provide a safe home for New Yorkers citywide to thrive. The organization's main program sites are located in Manhattan's Chinatown, Lower East Side, and the Two Bridges neighborhood. Ms. Cheng has been with HMH for 27 years, providing both direct services and executive level leadership to welcome New York's most vulnerable populations, including the elderly, children, new immigrants, and refugees. The second panelist, community panelist we have is Varsha Singh, who is a neuroscience stroke program manager, an expert neuroscience nurse practitioner, as well as SME on stroke program accreditation and management. She has presented at local, national, as well as international nurse practitioner conferences and at the World Stroke Congress. At present, she is serving on the SCAP Stroke Care Advisory Panel, NJDOH, New Jersey Department of Health, Communication Subgroup of the International NP-APN Network, Vice Chair of Jonas Scholars Alumni Council, Education Committee of American Neurovascular Clinicians, Membership Committee of World Stroke Organization, and as a nurse champion for climate change. She's on our advisory board of SATI, South Asian Total Health Initiative, and she's also a community stroke educator for South Asian communities. And last but not least, we also have a third panelist, Mr. Mitchell Wu, who has 20 years of experience working in higher ed as well as a nonprofit. He is a native of Queens, New York City, and Mitch is trained in critical race theory, receiving his master's in comparative ethnic studies at San Francisco State University. Mitch applies this to his nonprofit work when it comes to advocacy, capacity building, and human services. Mitch also teaches Asian American Studies and Ethnic Studies at CUNY Hunter College and Peralta Community College.
Thank you, Keith. And let me introduce the three more academic panelists here, and then we move on to academic panelist presentation. So the second academic panelist is Dr. Arnav Ghosh. He's assistant professor at Cornell University. He's a physician scientist and a new US citizen originally from Australia, where he grew up. His father is an Indian and mother Burmese. He's trained as emergency physician in Melbourne, Australia, and previously served in the Australia Army, undertaking natural disaster resource management. His disaster experience ranged from wildfire management and providing direct care during wildfires, hurricanes, and heat waves in the Australia during 2009 to 10 bushfire season, and also in the United States during Hurricane Sandy in New York City, and in the aftermath of Hurricane Irma in Puerto Rico, 2017. He's an academic physician, as I said, whose research focuses broadly on health effects of climate change with a focus on climate-amplified extreme weather events. The next panelist is Dr. Yoon-Young Choi. She is a postdoctoral associate at New York University School of Global Public Health. Her research has been specialized on social determinants of health among minority older adults, with particular emphasis on addressing Asian health disparities. Her recent work delves into the effect of environmental exposure on Asian neighborhoods and its implications for residents' health outcomes. The last but not least panelist is Dr. Kai Huang Nguyen, is a research social scientist with expertise in urban adaptation governance, industrial land use and development, and community-based adaptation planning. She's awarded her doctorate in geography from Rutgers University in January 2023. She currently serves as an external advisory member on the Equity Working Group for the New York City Panel on Climate Change. She previously worked as a graduate researcher for New York City Panel on Climate Change, the Consortium for Climate Risk in the Urban Northeast, and the Hazard, Vulnerability, and Resilience Institute. She holds a dual bachelor's degree in geography and anthropology from University of Georgia and master's degree in geography from University of South Carolina. Please welcome these distinguished panelists. We'll start with a presentation by Dr. Chan.
Thank you, Soko. Let me share my screen. See if I can do this. All right. Can everybody see my screen? Okay. All right, and let me also make this into a slideshow. Here we go. Can everybody see that? Yes? Okay, perfect. So today I'm just going to talk briefly about healthcare and the climate crisis and preparing America's healthcare infrastructure to address health equity for Asian Americans. So in terms of what I'll talk about, I'll talk a little bit about the healthcare systems and the climate crisis, and then also a report that I have worked on that came out in 2022 from the U.S. House Committee on Ways and Means, Democrats, titled Healthcare and Climate Crisis, Preparing America's Healthcare Infrastructure. So a little bit of background, and the following speakers will talk more about this. But in terms of the healthcare system and climate crisis, the U.S. healthcare system is actually responsible for an estimated 10% of national greenhouse gases, GHG emissions. Now, this is somewhat shocking when we first started finding out about this, because oftentimes healthcare systems, they think of themselves as healthcare providers, and they don't really think of themselves as polluters. Greenhouse gas emissions are a direct cause for extreme weather events, which means these are dangerous storms, droughts, floods, and wildfires. And also, it's a direct cause for worse population health outcomes, such as increasing rates of asthma, infectious and vector-borne diseases, compromised food supplies, and also deaths. And there's really a substantive body of research that has highlighted this. The consequences of the climate crisis, however, also accrue inequitably and disproportionately impact vulnerable and marginalized populations. A lot of this has to do with where these populations live, the resources that are available. Over time, what we're also seeing is that extreme weather events have become more frequent, deadlier, and also more costly. Now, in terms of Asians, along with Blacks and Hispanics, are much less likely to report good water and air quality in their communities, are also more vulnerable to extreme weather events. So a little bit about Congress and House Ways and Means. I just want to at least give a little context. The Ways and Means Committee is the oldest and the most senior committee in Congress. It's also the chief tax writing committee in Congress. So All the stimulus, most of the stimulus funding that came out in the last few years actually went through House Ways and Means. There are 6 subcommittees. I serve on the subcommittee on health, which has total jurisdiction over all of Medicare. And then we also have a number of committees that provide oversight, responsible for Social Security, select revenues measures, trade, and also work and family support. So these are some of the key findings from the Ways and Means report, which we put out back in 2022. So beginning in March of 2022, the then chair, Committee on Ways and Means Chair Richard Neal, when we had the Democratic majority, sent out an RFI request for information to hospitals, healthcare systems, healthcare providers, to really understand how climate events have impacted the health sector, and also what steps the healthcare industry is taking to address its role in mitigating the climate crisis. The committee received and analyzed responses from 63 providers across the country, which representing about health systems, dialysis companies, nursing home corporations, and community health centers, among others. So some of the key findings, even though we had a fairly small sample size, these were healthcare entities that were responsible for providing care for probably over 50% of the country. And almost all respondents, regardless of region of country, reported experiencing extreme weather events. And what we're talking about is 4.2 in the last 5 years. So for the most part, almost one every year, right? Some large healthcare systems and hospitals have some dedicated resources to address the climate crisis through programs to reduce emissions. Most smaller healthcare organizations, such as community health centers, have limited or no resources available that are dedicated to addressing the climate crisis. Now, a lot of this has to do with the fact that there are just not really dedicated resources because these are entities that are too small to really have that. But to be fair, one thing I would say is that in terms of the carbon footprint and the climate crisis footprint, it's really the large healthcare systems that is really the biggest contributors. Something else that came from this report was that community-based healthcare entities are the first responders for the most vulnerable Asian Americans. And the lack of resources for preparations will result in more death and suffering in the future for those who bear a heavier health burden from the climate crisis. So really kind of highlighting the need for us to really kind of look at it at the community level. So these are some very quick snapshot findings from a series of reports that we put out, and these are available at this particular site, which I can send out to everybody afterwards. And then that's really it. That's all from me. So, all right, thank you.
Thank you, Dr. Chen. Next presenter is going to be Dr. Choi.
All right, Lisa, could you share my slides that I sent you?
Yes, no problem.
Thank you. Okay. All right, so today I'll talk about the climate change and health impacts, focusing on Asian American living in California. As we know, the climate change carries a spectrum of health consequences with different communities experienced to varying degrees. And understanding how climate drivers create and sustain health disparities needs the consideration of a multifaceted metrics, starting from individual exposure levels to climate events and the sensitivity of each person to these events and their ability to adapt afterwards. Importantly, these elements are shaped by social and environmental conditions. And when it comes to Asian Americans, additional layers of complexity arise. Residential segregation, rooted in structural racial discrimination, and also social cultural barriers like language issues and cultural beliefs can significantly affect their exposure and adaptive capacity to climate change. So my research delves into this particular intersection, and I'll be sharing some initial findings. So the next slide. So this study uses data from the 2021 California Health targeting adults aged 18 plus. And for the first time, 2021 CHIP data asked the participants about the questions related to climate change. So for the exposure, they asked participants in the past 2 years, have they personally experienced any hazardous weather-related events? For example, heat waves, flooding, and wildfires. And among those exposed, they also asked whether their mental and physical health affected by any of those events. So the next slide. Okay, so the first graph on the left illustrates exposure rates among different racial ethnic groups. Asian Americans overall reported a 39% exposure rate. This is slightly higher than Hispanics and Blacks, but significantly lower than whites. But there are substantial disparities within the Asian American communities. Subgroups like, surprisingly, US-born Asians compared to immigrant population and those living in suburban areas, and the younger generation indicated higher exposure levels, somewhat comparable to whites. And also the next slide shows there are also disparities in the mental and physical health consequences. In this study, 14% Asians reported mental health impacts. This is higher than Blacks, but lower than whites and Hispanics. However, it's also important to note the variation within subgroups. So adults aged 26 to 34 and those living alone and people with asthma reported substantially higher impacts. And as for physical health, only 10% of Asians were affected. These are lower than any other racial groups. Again, certain subgroups, such as those with asthma, diabetes, and those living in rural areas reported significantly higher impacts. So the next slide. So these results underline the need to acknowledge the diverse experiences within Asian American communities. And I'd like to conclude my presentation by discussing future directions based on these initial findings. First, a lot of proportion of Asian Americans are immigrants from diverse countries. So a person's cognitive region could play a significant role in their subjective perceptions of exposure and adaptation because each country experiences different climate conditions. And interestingly, somewhat not intuitively, our data reveals that immigrant Asians reported lower exposure to and impacts from weather events compared to US-born Asians. This may reflect first the fact that immigrants are less vulnerable to climate change. However, this could be also attributable to lower levels of awareness due to first unfamiliarity with local climate, language barriers, acculturation issues, and possible biases in reporting mental health problems. So one way to level this discrepancy between the actual exposure and the awareness is to use objective weather data and see the geographic variation, particularly in Asian-dominated areas where many immigrant population lives in. Okay, so this is end of my presentation.
Thank you very much, Dr. Choi. Please hold off questions until we go through all the faculties and then community members' reflections. And then we'll have a time for questions and answers time. So the next presenter will be Dr. Ghosh.
Thank you very much. Appreciate the time to talk. So my name is Arnav Ghosh, and I'm going to be speaking a little bit about climate amplified extreme weather events in Asia and Pacific, and particularly how they relate to the United States. We know that as someone who has migrated, I think like a lot of people who have family overseas, we often think about our loved ones abroad. And we understand and we know now that climate amplified events are affecting people across the globe, and particularly in the Asia-Pacific region. We've seen, even in recent times, heat waves strike India. We've seen last week typhoons strike the Bay of Bengal, Burma, the Philippines. And these events will only happen more frequently. And so there's an opportunity, I think, as a global community of people being affected by these events to understand how they affect our loved ones in the countries of where we come from, but also how they relate to the issues of equity and the management of people's health in the United States. Next slide, please. So an example that I come up with, I'm originally from Australia, and we've seen a lot of climate amplified events hit Australia in the last 3 or 4 years. Just before the pandemic, the worst bushfires in history happened and burnt extensively the east coast of the country, bringing to almost extinction animals like koalas. And thereafter, the following year, actually in the first couple of years of the pandemic, we've seen the effects of La Nina happen, where there's been extensive flooding in the same regions that are affected by fires in parts of the northeast, the southeast, and even down in the south. And so there's opportunities here, I think, as we think about what's happening to these communities and the people abroad in the Asia Pacific region. How do we take that information and what can we learn from that opportunity? And this is where really my research comes into play and how I think about it. In 2009, 2010, I was an emergency physician working in one of the biggest burn centres in Melbourne, Australia, which is down in the south, when prior to 2019, 2020, the largest bushfire season happened. At the time, there was questions about how best to evacuate patients who were in harm's way from these fires. And they had a policy at that point that spoke to deciding prior to the fire starting whether you should leave or whether you should stay. And if you decide to stay, there were certain things that you needed to do in your house. You're meant to remove leaves from your gutters. You're meant to clear the lawns. And if you left, you packed and you left and you drove as quick as you can. Because historically, there was evidence to say, if you tried to outrun a fire as it was approaching your doorstep, you're more likely to perish because the fire would actually take you over. Now, what we found at that point was that that was not the correct strategy and that all people should leave. And an exorbitant number of people died as a result of that. And I was an emergency physician in the largest burn center that night, and where I watched 30 to 40 ICU level patients being admitted who had been extensively burned, having that policy really failed. And so that encouraged me and made me think very deeply about the issues of emergency management at the time. And it subsequently informed, I think, practices both in Australia, but also on the west coast of the United States, where we've had extensive bushfires and wildfire seasons in Oregon, California, and up in Washington State as well. In addition to that, another prime example of where emergency services play an important role is in the use of low-tech technologies to encourage and protect against climate amplified events. I think the most important example here is in Bangladesh. Now, Bangladesh is a country that abuts the Brahmaputra and the Ganges Delta, and is extensively very low lying. It's also at the peak of the Bay of Bengal. And Bangladesh has historically been prone to cyclones, and many cyclones have hit. Historically, since the 1970s, over 500,000 people have directly perished from cyclones in Bangladesh. And because of the need to do something about it, they've gone ahead and built one of the best low-tech systems of detecting, surveying, and protecting populations from the direct effects of these cyclones, which involve incorporating healthcare workers to note that work and coordinate with their bureaus of meteorology to detect these storms and send the messages to the right people at the right time and give an opportunity to take these people out of harm's way. And I think that as these climate amplified events take place, and they will happen more frequently, intensively, and more severely, we'll have to start thinking in these similar ways. Because as Dr. Chan mentioned, there's a lot that needs to be done at a health system level to accommodate the effects of these climate amplified events. Last slide, please. And this is also intangibly linked, I think, to this global phenomenon that we understand. The links between what's happening on the West Coast or even the entire United States and what's happening in the Asia Pacific region. And I think this uniquely brings together the global nature of this issue. And that even though the people may be different, the cultures may be different, and how we operate things may be different. There is ultimately a way that we need to approach this together. And the La Nina, El Nino, the ENSO phenomenon, in my mind, is one concrete way that we see these linkages. If there's a firestorm and drought in Australia, there's atmospheric floods and extensive rainfall on the west coast of the United States. If there's flooding in Australia and typhoons in the Philippines, you're going to see drought, which has happened for the last 10 years in the west coast of the United States. And so I think, just to underline this point, we have the opportunity, given we're all experiencing this, and particularly the Asia Pacific region, to work together to understand, address, and mitigate the threat of climate amplified events. Thank you.
Thank you very much, Dr. Ghosh. The last not least speaker is Dr. Nguyen.
Dr. Nguyen, you're on mute.
Okay, can you hear me now? Okay, cool.
Yes.
Okay, slideshow. All right, can everyone see that? All right. Yeah. Oh, I'm sorry. It has hang on. This thing has for some reason has animation on it. So yeah. Okay. Good. Okay. So. Hello, so happy AAPI month. I'm very honored to be part of this panel, and I'm looking forward to a fun and productive conversation. So I'm Kai Nguyen, and I'm an expert on community-based adaptation planning. For the last decade or so, I've had experience researching how Asian immigrant communities deal with environmental justice issues and how they were able to affect change. Some of the work I've done that is relevant to this webinar include examining how the Vietnamese community in New Orleans was able to successfully recover after Hurricane Katrina, and how environmental justice community in New York City are working to advance the climate justice agenda. So for today's short presentation, I'm going to be talking about challenges and opportunities for Asian American communities when it comes to adaptation. Public health and community health are certainly very important dimensions of adaptation planning, yet there remains a lot of gaps in terms of providing tailored responses, particularly to meet the needs of historically marginalized and disadvantaged groups. So I'm very interested to hear from everyone here else here as well. Okay, so I'm very New York focused. So, and as a geographer, I love a good map. So this one comes from the New York City Department of City Planning. This illustrates the diverse population of New York City by race and ethnic origin. And as we can see here, represented by the red dots, there are concentrated hotspots of Asian population that disperse throughout the city. According to the 2020 census, there are nearly 1.4 million people who identified as Asian or of Asian descent. They account for 15.6% of the 8.8 million residents living in New York City. Chinese represents the largest group, about 500,000, followed by Asian Indian, about 200,000, then followed by Koreans, Filipino, Bangladeshi, Pakistanis, Japanese, Vietnamese, Thai, Cambodian, and then etc. In over the last decade, the Asian population grew by 345,000 people, accounting for 55% of the city's growth. So this is one of the fastest growing group in the city. Contrary to the stereotype of the socially, economically mobile model minority, about 1 in 4 Asian adults, or 23% of Asian New Yorker who live in New York City, live in poverty. And that is a rate that is significantly higher than the citywide average of 16%. This rate is even higher among the elderly and those with high school education or less. That there are long established resident, and this is the diverse group. They are long established resident. There are also recent arrivals. So as you can see, the Asian populations, and in New York City, I'm speaking for New York City, are very diverse in terms of nationalities, identities, and socioeconomic backgrounds, and hence adaptive capacity to respond to external stressors. And with that picture, let me get to the case study. So this case study is a part of my research for the New York City panel on climate change, as well as my dissertation. And for this research, I examined how community actors and local organizations influence the outcome of 2 urban planning projects. While this research didn't really have like a specific focus on Asian population, it did touch a lot of the aspect actually touch on the Asian population. So and before I kind of talk about the findings, I'm going to give you a little overview of Sunset Park. So Sunset Park is a predominantly immigrant community located in the southwest of Brooklyn. Latinx resident accounted for nearly 40% of residents, and Asian about 30%, and the majority of the Asian population are Chinese descent. Nearly half of the residents identify as having limited English proficiency, a majority with a high school education or less, and 1 in 3 live in poverty. And due to these factors, residents tend to work in marginal retail, service, and downgrade manufacturing sectors, and are susceptible to labor abuse and exploitation. So for the Asian community, many residents work in the garment, or they used to work in the garment industry, but this industry has been on decline. So many have shifted to home care, retail services, warehousing, car repair service, both in Sunset Park and outside of community throughout the city. They tend to face language, job access, and housing issues. So consequently, they rely on community-based and religious organizations for social services, immigration-related information, and advocacy on their behalf. In this case, the Chinese Planning Association, particularly the Brooklyn chapter, and I know someone here is from the Queens chapter, among others, play a very important role in providing a variety of necessary programs and services for senior, youth, family, special needs, adult ESL, workforce development, housing, and NICHA placement. So with that kind of broad overview, what role did the Asian community play in shaping the Sunset Park climate justice agenda? Well, what I found was they had a very limited involvement in this process, and for multiple reasons. While the Sunset Park community is, recognized nationally for its community-led environmental justice and climate justice activism, these efforts were primarily driven by community-based organizations that service the Latinx populations. And secondly, it's partly due to geography. And as you can see here, the Latinx population lives along these 2 major avenues closer to the waterfront, to the industrial waterfront. So this purple area is a heavily industrial area, so no one lives there. But right next to it is a large Latinx communities. And the Asian population lives in kind of this red circle here, more upland. So they're further away from the industrial waterfront. And so they're not as affected by, so the Latinx populations were because of their geography, were much more concerned about exposure to flooding and exposure to industrial contaminants, as well as the compound impacts of flooding of these industrial facilities. And because the Asian population are further away upland, these are more or less of an issues. And secondly, it's partly due to the lack of engagement and mobilization among Asian residents when it comes to issues related to climate change. When I talk to representatives from the sort of the Asian community, there's not a lot of interest within the Asian communities in terms of being aware that climate change is even an issue. And for many overstressed and hardworking immigrants, climate change is like the last thing on their mind. And given that their priorities is on, securing food and housing. And while this perspective continued to persist, Asians, New Yorkers are not immune to the impacts of climate change, right, and extreme events. For example, during Hurricane Ida, nearly all of the 11 basement flooding deaths in New York City were residents of Asian descent. Because they were living in below ground dwelling units that were particularly susceptible to storms. So with that, I'm going to kind of talk about the challenge and opportunities. So, I think the Asian population in New York face, and I think the other panels have already talked about multiple barriers that are related to language, cultural beliefs, educational, and I would say generational, right? There's issues communication between the youth, the younger generation who are much more fluent in English, with the older generations who much more, per se, conservative in their cultural beliefs, and also less fluent in language and the culture that they're in, the dominant culture here in the US. And these affect their abilities and interest in participating in community planning and, by extension, adaptation plannings. And because the problem is, if you don't understand, if you don't participate, it's really difficult to kind of articulate your needs and get funding. And so these barriers actually needs to be addressed, really, in order to develop tailored responses to meet the needs of particular communities. However, there's a lot of, while there's a lot of barriers, I also see a lot of opportunities. And one thing I see, and this was also brought up before, is the role of community-based organizations, like health organization or ethnic-based organizations, in providing, appropriate emergency preparedness training, or raising awareness, raising emergency preparedness awareness among residents. So, for example, the CPC, the Chinese Planning Council, I think, they work with a representative around the communities to train people on how to act during emergency event. They also use the ACT WeChat to communicate among residents, as well as have people keep an eye on older residents. In addition, there's also a role in engagement and mobilizations not in New York City, but in general in Sunset Park. I have learned that engagement and mobilization is a good way to get attention, to point to, to highlight the needs and challenges in the community, and the role of local champions who are doing these kind of work. In addition, in terms of adaptation, each communities are so unique that adaptation need to be hyper local. And so we're going to need to have tailored response to address health vulnerability to environmental hazards and climate hazards. And again, this has been brought up by other panelists. Environmental pollution is a big problem. Heat is a big problem, particularly for the elderly, and in communities like in EJ communities that lack green space, or like cooling centers. And flooding, we didn't think about, Sunset Park is it's on the coast, and a lot of the attention was on coastal flooding, but there's also need to be attention to inland flooding because of the basement deaths. And finally, I think that there's a need to promote emergency preparedness and civic participation among Asian communities who are much more, who are a little more conservative in terms of, and hesitant, I would say, in terms of engaging with the political process for multiple reasons. All right, so thank you.
Thank you so much, Dr. Nguyen. Before we move on to open panel discussion, I'd like to have each community member to sort of share their thoughts or comments, maybe some stories that or some reflecting what you heard from the academic panelists.
Sure, yes. So we invite first Mitch Wu to begin and share some thoughts. Mitch, you're actually the director of the Queen's CPC, right? The Chinatown Planning Council.
Yes, correct. Thank you so much. Can folks hear me okay?
Mhm.
Just give me a thumbs up. Thank you. Just want to thank all the presenters and everybody who came on today. In regards to our work on the ground, again, my name is Mitchell Wu. I'm director of the Chinese American Planning Council, CPC, director of our Queens Community Services. And so in terms of a lot of the on the ground, grassroots, cultural competent, linguistic appropriate kind of methods of how we reach a lot of these more hard to reach, vulnerable communities, we implement a lot of those particular type of ways to get them engaged, right? So we talk about so many different barriers, right? So there's barriers about engagement, there's barriers about language, culture, but then, you know, when you look at these communities, many of them are also very working class, right? So those are also additional hindrances. And so I just want to first off by saying that, you know, when we talk about climate justice and resiliency, I mean, it really is about racial justice, right? So I want to say that, you know, first of all, top of the hand, you know, and I think that's a thing that a lot of folks have already mentioned and alluded to earlier, but I want to kind of just hit that, you know, stamp home, right? Because it actually intersects with all these other particular social markers, right? When it talks about race, we also talk about obviously immigrants, right? Seniors, older adult populations, the special needs, intellectual developmental disability folks, non-native English speakers, right? Working class folks, poor folks, women, right? These are all these intersectionalities that got impacted when he talks about access to resources, access in general, infrastructure, right? And so it actually impacts not just their health, mental health, access to gainful employment, benefits, all these type of things when it connects to climate. And so for us, whenever we deal with these type of calamities and all the ones that was mentioned earlier about New York, we were on the grounds, right? So when it talks about, you know, Hurricane Ida, or even as far back as like Hurricane Sandy, right? We saw how these impacted our communities, from the basement dwellings to people losing their homes and lives. And actually CPC actually applied for the Hurricane Ida relief monies as well, right? And so we've been doing this stuff to make sure that folks are getting awareness, folks are properly trained, and then folks also have access to these type of support, right? When it comes to safety nets, whether it's referrals for counseling, mental health, access to additional, you know, affordable housing, or also jobs, gainful employment, or relief monies. These are the stuff that we really try to connect these, you know, more so working class, hard to reach immigrant communities and families to. And we've done that, you know, even with during the pandemic, right? You know, when it comes to trainings, we even did bystander and upstander trainings, right? When it comes to the Asian hate work. And so this overall climate, you know, just the environment of where these people are, I feel like, you know, one thing I do want to say is that sense of cultural sensitivity, right? And understanding like where to meet the communities is key, right? And when it comes to these larger issues, and it was aforementioned that many times people, especially working class folks or immigrant folks, are not aware or privy to like what climate change means to them, you know, because they're just really kind of like stuck to making sure that on their daily grind, right? You know, providing food for their families, making sure like, you know, they can pay the monthly rent and et cetera. We really want to make sure that they're educated, make sure that they have access to resources. And the third point I will also say is that they're also kind of like activated in the advocacy process as well, right? We want to make sure that their voices are heard. So, you know, whether it's, you know, administrative advocacy, policy advocacy, or just additional resources when it comes to budget advocacy, that these voices that are not traditionally heard are also at the table.
Yeah, thank you so much, Mitch. So next we'll go to Isabel Cheng.
Thanks, Dr. Chen. It's so exciting to hear the panels, and I'm very excited to hear about Sunset Park because I used to work in Sunset Park, understand the community, and live near Sunset Park. So that kind of makes my blood like get so like, oh, how can we help? But I work actually in Lower Manhattan, so most of my work is in Lower Manhattan, and that's because that was drawn to what I want to work with is the Asian community here. But I also want to say that, you know, we've gone through 9/11, we've gone through Superstorm Sandy, we've gone through now COVID, but just a few of the takeaways. And you know, it's been 10 years since Superstorm Sandy, and yet, you know, the remnants, we still are suffering from still waiting for NYCHA to fix, the facilities there. So talking about disparities, talking about inequities, this is still happening even after 10 years. And people are living in mold, things are infested. And there, in this one particular housing complex, there's about 1,000 seniors, Asian seniors who live there. And you can imagine just the fact that we can't seem to get our government to come in and fund these kinds of, or at least get it fixed in due time. But I do want to bring up a few vignettes and also some of the takeaways that I've experienced through these times of disaster or in this community. So for the 4 elements that I've seen is really having key partners before and after, and particularly before. So we run 2 very large NORCs in Lower Manhattan. And because people don't know what a NORC is, it's a naturally occurring retirement communities that has a partnership. And the 3 partners are the management committee, the owners, the health partner, which is our partners, VNS, and the community-based partner. So 3 of us work together, have advisory boards that meet quarterly for the last 10, 15 years, just talking about issues. But once in a situation like Hurricane Sandy, we were able to work very quickly, have a list of seniors where they live, where they are, contact them, and during COVID, calling them, making wellness calls. This is so key to keeping our communities connected, but also emotionally and physically on some sort of way for us to be, we are kept on call with what is real time. So this is very important. And one of the things is indirect, causes. So someone had mentioned, I think Dr. Chen had talked about, some of the things like, some of our seniors, mobility is an issue. And during Hurricane Sandy, we had a couple who lived right by the seaport, and they were told to evacuate. Not knowingly, they evacuate 3 blocks away because that's where their relatives live. And these are seniors probably over their 80s. And after that, that building that they were in was even worse because they lost all electricity, elevator, and they, in essence, caught a cold, had pneumonia, and unfortunately passed away. So these are things that we need to look at, that seniors can't, mobility is an issue, they can't move as fast, and these are indirect causes of these natural disasters that we have to take into consideration. And the other part is also utilizing older people, because when we utilize human capital, this is so important. We can have them be part of the planning, because most times seniors are, I know I'm talking about more about aging seniors and Asians, but they're not usually in the discussions of preparedness. They don't know what's going on. They have no idea what the resources are out there. So they do count on community-based organizations like us, Hamilton Madison House, CPC, and other close by organizations. But the key thing is you have to have the linguistic and cultural competent staff to help these situations, because we can have FEMA come in, which they deploy many people, staff to come to New York City, but many of them don't speak English. So we're still coming in to provide the translation. So if we could build a pool of human capital of people older than 55 would be really resilient, because we find also seniors or older people react to older people better. They help each other. They seem to understand. They understand what they're going through. I was given the information that or learned that most of the frontline workers during Superstorm Sandy was the average age of 51. So we shouldn't forget that there is this whole pool of people that can be deployed to help out with our communities, particularly if we need language. And the other thing is local neighborhood infrastructure. We found that also, having not just linguistic and cultural competencies, but we were the first community-based organizations to respond as quickly as possible. I think if we are also to, let's see, lack of integration. So what we also found was sometimes COVID also was a sample where I don't know if people understood that there was a system called Get Food, and we were supposed to get our seniors to be registered, and that took a whole production to do that, and only to find that they're only receiving pretzel and apple, crackers. And so it took so much to try to change the whole mindset, or at least to bring in food that would be culturally competent for our seniors. And that to bring that into effect has taken so much time, advocacy, also being mindful of our communities, of the diversity of our communities who are vegetarians. That's just as simple as that too. Some of the other things that I have to say that we also did during COVID was that some of what we found is some of our participants, we have a caregiver program, a citywide caregiver program. What we found is that during COVID, the caregivers couldn't visit their family members. Our seniors were left alone emotionally. So one of the things that we were able to do is provide care packages. Even a gesture of sending something to them meant so much to not only the person receiving it, but to the caregivers who couldn't go in to see their moms and dads or their grandparents. These are things, again, without the list, without having those partnerships in the beginning, it's very hard to do the crisis management during a crisis. And we've gotten so many calls from our neighborhoods who do not have government funding or do not have these infrastructures already in place that would call us and say, hey, we have 300 seniors who live here, but we don't know how to get food out to them. How do we call them? They did not have telephone numbers. They didn't know how to reach them. And when you try to do this during a crisis, you just tend to not get seniors to respond to you because you need to build that trust with them in the very beginning. So those relationships were always already forged from the very beginning. So I really stress that's one of the few things that I would say is very important in terms of disaster preparedness. And I think one of the other things is also medications. We've gotten calls from, because we run a mental health clinic, calls from people who said that their doctors, their psychiatrists weren't responding. And fortunately, they were able to somehow call us, speak Chinese to us over the phone and get our psychiatrists to help with their medication. So I think, starting from a state level to city to the community level, if it wasn't for the state enactment of allowing pharmacists to give out medications, also the whole governor doing the executive order allowing telehealth. So these are very key from the Fed, state to the community levels to allow community-based organizations to function and do their jobs in response to any kind of disaster. But I'm going to pause here and thank you so much for this opportunity.
Yeah, thank you, Isabel. I realize we're starting to run out of time. I hope we can stay for a little longer to hear from our third community member, Varsha Singh.
Yeah, that'd be great. And then I wanted to say, if anyone has to leave, please leave some comments or questions on the chat so we can take those and later maybe we can communicate through other channels.
Okay. Thank you so much for this wonderful discussion on climate change. I'll keep it short, but when I'm listening to Dr. Choi, Dr. Yuan, and Isabel Cheng, Dr. Ghosh, there is one theme that yes, climate change is a crisis. And what we are talking about today is not just to prepare for the disaster that's going to happen, but we have a great opportunity to prevent it. So I'll just cite how climate change will affect the health of AAPIs. There is little or almost no literature about this relationship. I read a couple of articles. One was published in January 2023, Sunny Sun, Yale University. And she did a study, just evaluated, I think it was a synthesis of all the articles, and she found there was no literature, so there is a need for research. From my experience as a healthcare provider, I believe that climate justice starts with the fundamental awareness of teaching our community. First of all, what is a greenhouse effect? No community member knows that it is simple accumulation of 3 noxious gases in our atmosphere. Just making them aware that it's methane, it's carbon dioxide, and it's nitrous oxide. And just making them aware that this is what you can do as an individual to reduce the emission of these gases. And this is what I will share my experience, what I have done since 2020. All I have done is created a nice PowerPoint presentation for the nursing community. Why climate change is happening, what is responsible for climate change, and what you can do as an individual. So looking at University of California's organize this climate justice oriented solution, they have 6 pillars. Number 1 is just transition. Everyone needs to understand how are we going to become climate friendly. If you really don't know, if our community doesn't know how to, we will be doing what is known as crisis management at every step. We need to engage them. They should be having that social responsibility that, yes, I'm going to change my behavior, my practices. I'm going to contribute to reduce the methane, nitrous oxide, and carbon dioxide production. We definitely need social, racial, and environmental justice, indigenous climate action, community resilience and adaptation, natural climate solution, and most important is climate education and engagement. Believe me, when I proposed climate change initiative at our State Nurses Association, I had one person in the breakout room because the rest of them in another breakout room talking about staffing issues during COVID. And I said, no, it is all catch-22 because if we are not going to preserve our climate, all the healthcare providers they will have to be prepared for the disaster preparedness, emergency preparedness, just like Katrina, Sandy, and of course, even COVID, which is a novel viral disease, which we experienced in last 3 years. As a healthcare provider, I also want to share with this group that it's not that nothing is happening. There is an organization which is known as Green Hospitals. There is a website. If you Google, it will come, Green Hospitals. Memorial Sloan Kettering, Stony Brook University, they are part of that Green Hospital project. In New Jersey, we have Hackensack Meridian, we have some Overlook Hospital. And what we have started in New Jersey, we are initiating a climate change committee through State Nurses Association. My goal is to engage nurses and healthcare providers as much as possible. And if we all remember, we started asking our community members, do you smoke? You should stop smoking. Similarly, the vision should be, we should be asking our community members, do you know what is climate change? Do you have access to clean water? Do you have clean air in your house? Do you have trees and plants around your house? Do you know that having more trees will reduce the temperature around our house? So these are simple questions. And I believe that we have a great project ahead of us as community leaders. And we need to have a bigger body talking about this change, which we want to bring, not only at the community level, but within our own, what I call it is those who are going to be leaders of this research project in future. Lastly, I just want to say that American Nurses Association has a position statement for climate change. They do consider it as a crisis, and they encourage all the nurses to engage their patients to have a conversation about climate change. And this is what we are looking in future. Each healthcare provider engaging individually each patient. Do you compost? Question mark. Do you recycle? Question mark. How do you get your water? Do you know if your house is in flooding zone? What can you do? What is rainforest harvest, rainwater harvesting? So if we look at other countries, I have spent last 3 years in watching videos about what is happening in India. I will share the website. It's called Eco India for Climate Change Initiatives. And I'm amazed what has happened in villages, in remote villages. We have great examples out there. And I believe that we all can make a big difference if we address climate change in timely manner. So thank you for listening to my experience and my points.
Thank you very much. I think we realize that 1 hour is too short to discuss this important issue, and there has been a very stimulating sort of presentations and comments that we just started. So think of this as the beginning of our conversation, and I'd love to continue this conversation in a different form. I think you heard how climate change and Asian community are kind of connected and in a local level and then global level. And I think you heard common themes, something like communications, awareness, culture sensitivity or competency, and then need for education. So there are lots of things that we talked about, and of course, how we as an individual can contribute to mitigating climate change as well. So thank you so much again. This has been a very exciting sort of presentations and talks that I heard that I love to continue somehow, and I will find a way as a project and then work with Bei and then Dr. Keith to make that happen again. Any final comments from Keith or Bei, if you're still there?
Yeah, I just want to say thank you to everybody for participating in this conversation. I feel like I learned a lot, and just knowing that this is an important issue for all of us, that was really, yeah, I feel like that was really rewarding.
Great.
Yeah, again, thank you so much for your wonderful presentation. I see, as a researcher, I see so many research opportunities that we, as a scientist, we could contribute, and hopefully that we will try to explore some collaborative opportunities in the years to come. Thank you.
Thank you. Thank you very much, everyone.
Thank you.
Thanks.
Bye.
Take care. Bye.
Bye.